Well, this is a great question, and there's a lot of different ways to peel this onion back. First and foremost, I want to make sure that my staff are buying into the technology. So, an initial KPI is, do the staff, do they like it? Are they utilizing it? Are they using it according to the manufacturer's instructions for use? And some of that I can accomplish through initial simulation validation. Number two is I want to go out and actually test it in the real-time clinical setting and make sure that it's performing. For example, I may want to do a trial where I look at 2 weeks of a device running and get a baseline of my air quality, where it's not running with the filter, as an example. And then I compare that to the use of the device when the filter is running to see if I'm getting a reduction in some of my VOCs, my CO2 levels, et cetera. And I, of course, should see that. That's the whole goal of a continuous and autonomous device that's improving air quality. But number three is, I think, the most important. At the end of the day, our goal, right, should be to eliminate or reduce surgical site infections when at all possible, right? No patient comes and seeks care with the expectation of receiving something that's healthcare associated, and rightfully so, right? Our goal is perfect care for every single patient. So the ultimate KPI is, can we really reduce or eliminate those preventable surgical site infections? And that is a journey, right? And so it's important that we look at the total holistic view of our SSI journey and also the interventions that we're taking. But that's the ultimate KPI that any healthcare facility, whether a hospital or surgical, setting like an ASC, should actually take into account.